During our last test here at the Cleveland Clinic, Dr. Gassman was able to successfully use smart goggles to identify skin abnormalities in a simulated surgical environment. Today is the moment of truth, the first human trial. The goal is for smart goggles to target the exact perimeter of the patient's skin cancer, which will then be surgically removed with one extraction.
Before we do anything surgical, we're going to uncover it and look at it with the glasses.
The patient is having a squamous cell carcinoma removed from their lower leg. The topical agent has been applied to the patient's skin. Dr. Gassman is then using the smart goggles to see the fluorescent images to identify the cancer.
So that would be one there. There's another spot. All right, so they sort of got a picture of it.
Can I turn on the operating room lights momentarily to see what you marked?
Yes. Okay, so what we have here is we have what we can visually see as the starting point of the tumor. The end of this here is our starting point.
And that's the area that fluoresced.
That's the area that fluoresced. And now I'm going to have to take a little bit more on the outside here.
Can you talk a bit about what you marked using the smart goggles versus the area you would have marked without the smart goggles?
As a surgeon, I'm obligated to go after anything that looks abnormal. What this, according to the heat map, if you will, I went more inward than the abnormal looking skin. So it seemed it might have differentiated between what is normal but inflamed and what is abnormal in cancer.
There is potential for this to minimize margins.
Yes, well, having the proper starting point, we don't have always the best way of figuring that out. It's a little bit of the guesswork. So anything that takes any guesswork out of medicine is a useful tool.